Okay, we are back. We're here with Dr. Kevin Smith, board certified ear, nose, and throat specialist or otolaryngologist, as we know, and also facial plastic surgeon. And he's giving us insight into issues related to cosmetic surgery versus plastic surgery. And I apologize for the echo. I'm going to say as little as possible. I'm going to turn the mic over to Dr. Smith. And Dr. Smith, can you give us an overview of migraine headaches and your approach to migraine headaches? And people have this concept of migraine headaches. And so they get medications and various other neurological treatments and workups. And you found something quite interesting. So I'm going to turn the mic over to you. Talk to us about migraine headaches and talk to us about your approach and what you found in this area.
First of all, I thank you for allowing me to talk about this. This is my passion, and I've been doing it for 30 years now, but it was only recently, say the past 8 years, that I discovered that the root cause of migraine headaches is not in the brain, it's in the nose and sinuses. We've all been taught in medical school that it's in the brain, it's some vascular problem with vessels dilating causing the pain, but only 5% of brain scans will actually show something to explain a headache, an aneurysm, an abscess, something like that, a tumor. So I've been doing sinus surgery for a long time, and it was actually in my fellowship when my preceptor told me, sometimes we do rhinoplasties and septoplasties on patients, and they would come back and say how they weren't having bad headaches anymore. So I practiced, once I opened my practice, I would just question people about their headaches, and invariably a lot of them who were undergoing sinus surgery would come back and say, the bad headaches I was having, I don't have them anymore. So I found that very fascinating. It was so prominent in my practice that I ended up writing a book called The Migraine Imposter, because I thought these headaches were not true migraines, but migraine-like headaches. And they were so severe and debilitating that I did a lot of research in the subject, and there are a lot of studies that were done by ENT doctors talking about contact headaches in the nose, abnormalities in the nose causing these headaches. But nobody has ever made the link from that contact headache to migraine headaches. That leap was made by me after I was on the doctor's show, and I started getting these scans all across the country for me to review of people who had migraines. And mind you, these are people who have suffered on average 20 years. They've been to the Mayo Clinic, Cleveland Clinic, Johns Hopkins, University of Michigan, Vanderbilt, Diamond Headache Clinic, and the like. And some of them have been turned away from those places. And so hundreds of people were sending me these scans. And as opposed to the brain scan only having 5% positive findings, 100% of the people that sent their scans to me had these specific abnormalities that I know cause migraines. It might be a deviated septum, it could be large turbinates, it could be a combination of that with some sinus problems, just numerous specific things that I know. And when I performed my procedure that I call the Smith sinus migraine technique, I was finding that 90% of these people were never having another migraine. And these are people who have all type of migraines, not just migraines of people who have sinus problems, breathing problems, and allergies. No, I've cured people, families of people with hereditary migraines. I've cured hormonal migraines, ocular migraines, complex migraines that resemble a stroke, hemiplegic migraines where people get paralysis of their arm and legs, and the migraine, once I've done my procedure to correct the abnormalities in the nose, the migraine goes away, and all that hemiplegic aura and things would go away too. So it's very exciting because there are 40 million people in the United States with migraine headaches, and 1 billion people worldwide. And I think that the protocol should be that everyone, of course, should get a brain scan. But incidentally, when you look at the neurological indications of getting a brain scan, is somebody with a severe headache that also has associated neurological problems. But we tend to fall in the ERs and stuff. You tend to You tend to want to make sure you don't miss an aneurysm or a tumor or something like that. So people get them anyway. And I've had patients that have gotten 14, 15 scans over a period of 20 years, and then they get one sinus scan, and I find what the problem is, do the surgery, and it's done. The surgery that I perform takes about an hour. It's an outpatient procedure. It's covered by insurance, a 90% success rate. It's not very painful. Most people say it's discomfort, and it's very effective. So it's very exciting. I mean, I had an anchor woman from Oklahoma who just did a story in Oklahoma, and had one of my patients on who had a hysterectomy to try to get rid of her migraine. She had a nerve stimulator implanted in her to try to get rid of her migraines. And while she was in the hospital, her mother was telling her that, she started a prayer group at the church and all. And she just told her mother, look, stop, because I'm praying to just leave this earth. I can't take it anymore. So luckily she found me, and we did a procedure, and she's been 2 years migraine free. She just had her nerve stimulator removed, and she's very happy. So the results are very rewarding. It's just amazing to hear all these devastating stories. And from that story, by the way, that was run on the news, we got like 300 calls. And so I kind of chuckled when you told me that some of the patients here were asking about the migraines, and you just happened to just mention it, and people were having questions about it because it's something that is needed. People are not living their best lives, and what I'm doing is giving people their lives back. And people deserve to live their very best life, and they need to make sure that when you're dealing with a severe headache, which is what a migraine is, it's head pain, that you don't just check the brain, you have to check the rest of the head. So what I'm doing is checking the sinuses and the nose, and solving a problem that's greatly needed.
And again, I'm doing everything I can, so I'm still working as we're speaking to get I went and Googled cancellation, and I'm working on that. But to ask you a question, you mentioned a number of things that were quite intriguing, because with this procedure that you've done, in the nose, you've cleared a whole myriad of manifestation of migraine, even with paralysis and the like. Now, I remember seeing on one of your news clips, in fact, you're on the doctor's show, where you went into some detailed explanation in terms of potential mechanisms of pathophysiology. And my understanding was that, your nose reacts, the soft tissue reacts in many different ways to sound, to smells, and different environments, maybe bariatric pressure, whatever the case may be.
Mm-hmm.
And it sends signals to the brain. Can you elucidate that for us a little further for our audience and help them? Why is it that when you go to the nose and pull out a bony spur of the nose, it gets rid of paralysis?
Okay, it's a very, very good question. I'm glad you asked it because I love talking about this stuff. Let's start with, I have patients that have these symptoms associated with their migraines. I'm just going to tell you. They can have syncopal episodes where they hear dizziness, slurred speech, blindness in one eye, tingling in the arms and legs, paralysis of the arm and legs, tremors, just tremors of the hands, and the list goes on. And also gastrointestinal problems, constipation, irritable bowel symptoms. So those are a few things. And patient after patient, I've had a 17-year-old girl just last week that told me that her irritable bowel is better. She can eat pizza and pasta. Her stomach is flat. It used to be bloated all the time. And it's all related to nerves when you think about it. So when you have this abnormality in your nose, and the nose projects from the face, it's close to the brain, it's a protective structure and very sensitive. I tell people now, when you get a COVID test with the swab going in your nose, it hurts, right? Why? Because the nose is very, very sensitive. Well, these abnormalities in the nose that are brought on by injury, and let's think about it, the first injury is coming through the mother's birth canal to get born. Your nose is getting pressed up against the sacrum. They can grow and have this deviated septum and other abnormalities in the nose that can trigger the pain. So you have this abnormal structure in the nose irritating sensitive tissues, sending signals to the brain, and along the way, you have to imagine it's electricity. You can have a single lightning bolt that strikes a tree, but you can also look in the sky and have lightning that you see that goes along the sky and into the clouds. And so for those people who have these myriad of symptoms that accompany the migraines, they're getting the latter where it goes across the sky happening in the brain. So the signal goes back, there are lots of nerves that are converging, and the electricity skips and hits something else, and they're the ones that get these symptoms of blindness and weakness and slurred speech and tingling and tremors. So once you remove that abnormal signal, that abnormal impulse, then you remove the ability of the electricity to come and do what they call it's called a cortical depression, where it spreads out in the brain and hits other nerves along the way back. So when I remove that, it removes the nidus, it removes the irritating focus, which removes the electrical impulses that are abnormal, and that's puts your body in a state of just calm.
So Kevin, when you mentioned something interesting, so you have a myriad of these symptoms, irritable bowel and various other things. Do these people have these symptoms in the context of a headache, or can these symptoms occur remote from the headache?
They can. I had one patient. What was that? What was that?
How do you link them together? Someone's
Yeah, here's how I linked them together. Very good question. I had one patient, and let's just back up. Baxter, you have to understand, I'm a very curious doctor. I've been that way since I was a kid. And so instead of me, I'll learn what you taught me in med school, but I want to do things and then I want to see how you react. Do it, see how you react. And I take mental notes of it. That's right. And so that's how I came to this, Bax. Yeah, I came to this because I'm very, very curious. And I don't take no for an answer. The body is made to be very logical. If there's head pain here that's so severe you can't work and you're disabled and you're considering suicide, we have to find why. And it's got to be somewhere in here. Yeah. It just does. I mean, we may not know it, and because we don't know it, it's mysterious, but once you see the results, then you know you're onto something. It's important that you follow up with that. So I had a patient, 27 years old, migraines for 9 years, constant headache every day. But during her period, she would have her migraines. And when she'd have her migraines, she would pass out, have dizziness, have paralysis of her legs and arms. She had to be medevaced from Belgium. She was on a mission trip, had to be medevaced back to the United States because she just fell out and they didn't know what to do with her. So she comes here and I do the procedure and get rid of the migraines. And she has not had in 3-4 years all those other weird symptoms that came along with her migraine. So I looked up migraines. What else are they associated with? What are the neurological disorders? There's a list of about 30 to 40 things: MS, dementia, ALS, chronic fatigue, irritable bowel, Crohn's disease, autism, Tourette's, Parkinson's, Alzheimer's. And when you look at the symptoms of all of those disorders, Baxter, I can pluck out the symptoms and plug them into my migraine patients. And these are conditions that are associated or comorbid conditions with migraine. So, of course, being the person I am, I'm going to ask, well, why is migraine associated with all this stuff? And when I look at all the symptoms of all this stuff, it's similar to some of the symptoms that I have in my migraine patients. So is the root cause that I'm finding in the nose actually leading and contributing to some of these other disorders? That's my question. And I have to tell you, Baxter, I had a lady in my office, migraines for 20 years. She worked for a neurologist. He just recently, before she worked for me, she worked for a neurologist. And then 4 years ago, he diagnosed her with MS. So she comes in, I did a scan on her, just a screening scan. And by the way, I do screening scans in my office all the time. You don't have to be a patient. You just call and say, hey, I have this condition. I want to have a CT scan, and we'll do it. It takes about a minute to do that. So I did her scan. She has classic abnormalities that I find in my migraine patients. And so one day she came in and she was walking with a walker, a little cane. I said, what's wrong? She said, my MS is flared up. I said, okay, let's go into the office and let me spray your nose with I have a topical anesthetic and decongestant spray. I sprayed it in her nose to shrink things down. I knew it would help the headache because it does. It shrinks the tissues away from the septum or whatever it's touching. And I knew it would help the headache. So the headache goes away, but 30 minutes later, she comes back and said, Dr. Smith, I don't need to use my cane. I feel better. And so I put her on some allergy sprays and stuff like that. And ever since she's been using that, she said her MS symptoms have been better, but we're going to do her surgery next month. I've had a gentleman who was a Hall of Fame defensive back with severe dementia came in and he got a scan. He has the same findings of the lady with the MS and my migraine patients. I had a young man come in who had Asperger's. I scanned him. He has the same finding in his nose that I find in those other patients. I had the young girl with the irritable bowel. I had one lady also, what got me onto that, a lady who I called for telemedicine to see how she was doing. She said, my migraines are gone. She said, but you know what's so strange, Dr. Smith? I said, what? And I'm so glad she told me that. She goes, I've had constipation since, I'm talking about severe constipation since I was 19 years old. And I don't have constipation anymore. I just go to the restroom. And I hear these things, Baxter. I'm looking at these, I'm listening. I'm like, okay, so that lady and the young girl with the irritable bowel, that's telling me that abnormal signal here was giving abnormal signals to the abdomen and the intestines. The intestines don't know what to do. They're not coordinated. They don't know how to get rid of the feces. So it just stays stagnant. But once I get rid of it, then everything's back to normal.
So you got my brain working here, Kevin. This is a highly dangerous interview we're doing here. Before I get into some of my thoughts, Celeste, how often do y'all see migraines in the pediatric population?
It's quite common in pediatrics, and most of the time, the things that we start out doing is recommending a headache diary, but with the children, the things that we run into is they're taking in a lot of processed food and sugars. They're up on the computers all night in the dark. They're not drinking enough water. So it's so many other things that are going on. We have to get that straight. And then I'm sure that we could get to the level where Dr. Smith could help them if we could get the other things kind of lined up better first. Because I think this generation is on the computer and on the iPhones and iPads so much that it creates some form of headache.
Yeah, that's interesting. And again, certainly lifestyle, we see that a lot with a lot of these conditions, irritable bowel and the like, certainly with lifestyle. But, as I'm listening to you, we do know that a lot of these syndromes, irritable bowel and the like, are connected to the central nervous system. And what I'm hearing you say is that the nose is connected to the central nervous system. And so this is another contributing factor, not only to migraines, but central nervous system mediated clinical manifestations. I mean, migraines is one thing, and we like to put labels on things. But,
right.
But what I'm hearing you talk about is potentially central nervous system mediated abnormalities. That could be a cardiac arrhythmia. Now
Well, I thought about that with, say, AFib that just all of a sudden spontaneously occurs. It may be worth us looking and scanning those people just to see what they have.
Yeah, and I think, and these things are multifactorial. I like Celeste's point is, I think, spot on. There are a lot of things that go into these, areas of problem, and certainly lifestyle and our complex issues. But we work very hard. I can think of a couple of patients offhand who have irritable bowel issues and have had them for a very long time. And so I may get on the phone with you, not in the not too distant future, and have these people evaluated, because I'm all about hitting these from every angle that I can. And you're looking at something that's a common problem. And is it always the bone spur, or the other types of?
No, there are other things too. And let me just tell you what you're doing, Baxter, is very important. And what Dr. Palmer mentioned too about the inflammatory diets. Changing your diet certainly will help, because anything inflammatory is going to cause the nose to swell. okay? Which then makes the contact points of those abnormalities more severe, which makes the headache more severe and the associated aura that go along with the headache more severe. So if you can reduce the inflammation with your diet that you talk about, your cleansing, Dr. Montgomery, that you talk about, then that all helps what I do as well.
Gotcha.
And it helps, and Dr. Palmer, it helps those kids. You're right. You can't be eating inflammatory foods because on one hand, some of those kids are going to be too young for me to even operate it on, even if they had the abnormality. And certainly the diet, if it helps, is something that they could do until they got of age. But certainly I have helped some pediatric patients, though, by being very conservative with some of the things that I can do with them. Some of them have bone spurs that are just so horrible that you just have to do the procedure. And I think the youngest I've done was 10 years old.
So I guess we're looking at a spectrum. So as you point out, certainly lifestyle, and if you have a horrible lifestyle, you're going to make things so bad. Maybe by just correcting that, a lot of people are going to be taken care of, because we've had people with headaches go away and things like that. But this helps me explain headaches in general, but all these other central nervous system mediated sequelae.
Right.
And maybe there needs to be kind of a comprehensive assessment. And I think we have to talk about how we deal with that, because we may be onto something, and maybe looking at it from a combination of things that we do.
Yeah.
Wow, this is very fascinating.
It is, Baxter. It's very. I'm so glad you had me on. It is. I see your little eyes twinkling because I know when we get off the show, we're going to be on the phone for a couple of hours talking about this.
You're reading my mind.
I know.
You're right on point. Here's a question. We'll make this the last one. We're running up on an hour, but this is great. Is reducing inflammation in the nose using essential oils reasonable? Any comments on essential oils in the nose?
Well, anything that will reduce inflammation, yes. Some of those essential oils are natural vasoconstrictors. Eucalyptus, menthol, those things, they will make the nose decongest. So it helps as long as the abnormalities aren't so severe. Some abnormalities are so severe, no amount of decongestion is going to help.
Can I ask a quick question?
I'm sorry, go ahead.
I said, can I ask a quick question?
Oh, sure, please.
So, I've always wondered the etiology or the reason for cyclic vomiting. So with, because a lot of times we'll see children who have cyclic vomiting with migraines. So is that a way that the body is trying to totally cleanse itself to decrease inflammation maybe?
Now you said cyclic migraines?
Cyclic vomiting, which is kind of started by the migraine. So they have a migraine first. They start having cyclic vomiting, which means they repeat vomiting over.
Right.
And over.
Yes. Yeah. Severe pain can lead to vomiting like that. Yeah. It just, I experienced one time I hit my knee. I didn't know I hit my knee one time on my desk. The worst pain I've ever had, even playing football, I've never had that much pain. And I immediately got nauseated. And it helped me understand that, it's severe pain that leads to nausea. I don't know why it does it, but it does. And it certainly does explain the cyclic vomiting and things.
And so there's a question about where you locate, Dr. Smith. I did put your website. Let me see here. Let me put your website address. What's your website address? It's kevinsmithmd.com. And I have two offices, one in River Oaks and one in Spring, Texas. Okay. So I'm going to put this in the chat, and I'm also going to put it in the on the feed here. I'm going to make a quick banner and put it on here. I thought I had put it in the notes of the student group that we have.
Just put you want to put the phone number just to have them call? Oh, there you go.
I will then put the phone number.
It's on the website, though.
What's the phone number?
It's on the website. Oh, it's 713.
Okay, it's on the website.
It's on the website, yeah.
Okay, good. So what I'll do is I'll leave that on the banner, and I'll also make a little scroll here, make a ticker, and so that'll
look
go
at you.
on. And we
technically expertise there.
I'm
impressed.
I can't get rid of my echo, but I can make a banner. How about that? But Kevin Smith, MD.com, y'all can find him on his website. This Dr. Smith has been very enlightening. And you read my brain. You will be getting a phone call. I won't keep you up too late, but I
Okay.
do want to pick your brain and share some thoughts with you because things have been ticking. And Dr. Palmer, as usual, thank you very much. And I'll be calling you, finding about how your day with the kiddos went.
Okay.
And so I got a number of calls. So guys, thanks a bunch. I'll see y'all backstage.
Thank you very much.
As I close out. As usual, I learn a lot, and I think I learned much more this time. And Dr. Smith and I have been friends for a long time, and we've talked about headaches, and I think I've got a few more pearls tonight than I've had before. And so I hope this has been enjoyable for you. We did talk about cosmetic surgery and plastic surgery in general, and you heard from one of the country's top surgeons, plastic surgeons and otolaryngologists. And he gave some insight into a very common problem that he's found a special approach to helping people resolve, and that's migraine headaches and related syndromes. So I hope this is very informative for you and very insightful. If so, as always, give us hit the like button, show us some love. Also, subscribe if you hadn't had a chance to do so. Hit the notification buttons because you get notifications of future talks, enlightening discussions and conversations. And please share this talk with anyone and everyone that you think will benefit from it. But until next time, keep it fresh, natural, and live.